we're having a conversation regarding World Cancer Day and things that we can do to reduce the death rates from cancer, and tips and tricks, everything in between, like we said, regarding that. And we'll be having our guest, who is Dr. Muhammed of Head of Oncology, NSIA-LUTH Cancer Centre, to be with us on the show. So please don't go anywhere. We'll be right back. All right, guys, welcome back. And like we said, we're going to be talking more about cancer, but we'll just give a brief context before we introduce our guest. And like we said earlier, cancer is a disorder when certain body cells develop out of control and spread to other body regions. And the top cause of death worldwide, accounting for more than so many fatalities in 2020. And of course, we know that the human race basically has been afflicted by more than 100 different types of cancer, right?
That's right. And like we mentioned at the start of the program, we talked about the fact that Nigeria has one of the highest cancer mortality rates in the world, with approximately, is it 1/4 out of 5 cases resulting in death, according to the Global Cancer Observatory. And this is one of the reasons why we're having a very special conversation with our very special guest on the show today.
And like we said, there's a need to fill that knowledge gap with education, and that's why our guest is here, so we can just kind of reduce the mortality rate that Nigeria seems to have regarding cancer, the importance of early detection, effective treatment, and increase in cancer prevalence. So our guest is Dr. Muhammed Habeebu. Welcome to the show, sir. Nice to have you.
Thank you. Good to have you
here.
Good
to have you with us. And you're the head of oncology at NSIA-LUTH Cancer Centre, and he's a clinical and a radiation oncologist, and you head the medical team at the NSIA-LUTH Cancer Centre. You've obviously had a very expansive career.
Quite the resume. Quite the resume. Yeah. So the theme for this year's World Cancer Day is Closing the Gap. And just a few minutes ago, we mentioned the mortality rate in Nigeria, particularly in Nigeria, is really, really high. So first things first, though, how important is it to close this gap?
It's very important to close the gap. Like you rightly said, there's a gap between the mortality rate of cancer in the third world, Nigeria being the leading country in the third world and in the developed world. And this gap is as a result of gap in knowledge, which is a result of gap in awareness and gap in planning, planning for this cancer treatment. And it's very important that we raise the awareness among the populace so that we can have early presentation. And it's also important that we raise the awareness within government officials, within other, partners, key partners in treatment of cancer, so that we can put in implementation that will improve the access to cancer care and also help in financing cancer treatment. Because if you want to really close the gap, you must raise the awareness among the populace so they can present early and know where to go. You must raise the gap between the facilities that are available so that we can have access to cancer care, and you must raise the gap in the means of payment, because if you are paying out of pocket, you can't have that access like those who pay with insurance. Yes, so there are a lot of places where we need to close the gap so that we can be at the same pace as the development.
All right, so can you highlight some of the different types of cancers we have in Nigeria as a whole?
In Nigeria, the cancer incidence is also going up, like it's going up in other the low and medium income countries. And today, the incidence of cancer in Nigeria is about 124,000 seen every year, according to Global Can 2020. So 124,000 cancer new cases are seen, and for prevalence is about double of that. Prevalence means if you add it to those that are already existing. Worldwide, we have about 20 million new cases every year. That's like the population of Lagos State every year. We have that worldwide. Nigeria is just one of the few countries, and in Nigeria, breast cancer is the #1 of that we see most, and this is a female cancer, you see. And breast cancer in Nigeria takes about 35% of all cancers. So if you are looking at 124, about 70,000 new cases of breast cancer are seen. Prostate cancer is next in line, and prostate cancer affects basically men. And about 15% of all new cancer cases we see in Nigeria is prostate cancer, accounting for about 50,000 new cases yearly. Cervical cancer is next to prostate cancer. Cervical cancer is also affecting women. About 12% of all cancer cases we see yearly is cervical cancer. And you know what that translates into. So cervical cancer and breast cancer are more common in women, and the mortality is also very high. Breast cancer poses the highest mortality, cervical cancer second mortality, accounting for about half of all the cases we see. You understand? Of all the breast cancer cases, what I'm trying to say is that mortality is about half the percentage of incidence. So up to half of every case we see die within 1 year, you know, for breast cancer. Prostate cancer also is the highest with mortality in men, in Nigerian men, even though worldwide lung cancer is highest in men. But in Nigeria, prostate cancer is highest. And prostate cancer, breast cancer, cervical cancer, all these are cancers that you can have very good prognosis if they are detected early. And they are cancers that you can screen for, so you can even get them even before they start. You understand? You know, becoming invasive. I can screen them to determine them at the very early stage, what we call stage 1. Cervical cancer, you can even discover it before it becomes cancerous, what we call precancerous state. That's the CIN. That's carcinoma intraepithelial. You understand? Neoplasm. So as at that time, it's not yet fully malignant. So, but all these are what are done in the developed world. You know, you have screening, you have awareness, so you nip every one of it in the bud. But when cancer develops, advances and spreads, it becomes advanced stage 4. It's very difficult to cure such a case. So yeah. So
let me, because we feel like we're having more a rounded discussion, what are some of the challenges that cancer survivors face, from, of course, money, lack of high cost of care, awareness, and also lack of equipment too?
Yeah, to start with, most of the cancer survivors, many of them are in denial because of stigmatization. Unfortunately, in this part of the world, people that have cancer are stigmatized. Even though we are breaking out of that ice gradually, we are having increasingly more people being able to come out to encourage people, you know. Then again, we have many distractions. We have many people who believe that cancer is not to be treated in an orthodox way, and then they have all form of so-called supplements, so-called some traditional, some spiritual, and all this leads to delay in presentation. And when they eventually present, there are no many facilities. Thank God we have NSIA-LUTH Cancer Centre now, which is the most comprehensive cancer center in West Africa and Sub-Saharan Africa. We have you know, facilities both for external beam, for brachytherapy, too, for the early and late stage. We have machines to, you know, manage them, and we have a very standard chemotherapy suite. However, we don't have enough in this country. So with people with cancer have to travel far and wide to reach centers that has the facilities to treat. Most of the centers that we have are not functional. At any particular time, only about half of the number of centers we have are functional. We have just about 9 centers in the, you know, distributed
in all of Nigeria.
Yes, to serve over 200 million, you know, people.
So now that you've mentioned that most of the centers are not functional as they're supposed to be, and we've been having this conversation for roughly 20 years, why hasn't the government and other organizations, maybe such as the World Health Organization, why haven't they swung into action to try to help the Nigerian people? The
unfortunate thing is that the facility for managing cancer are prohibitively expensive to install and prohibitively expensive to maintain. So even though at the moment the government is trying, they are providing facility in the 6 geopolitical zones, you know, they are equipping the centers, but they have not reached the final stage of being functional. We are having linear accelerator in each zone, and we are also having brachytherapy already installed in each zone, but it's still not enough. You understand? It's still not enough.
Now, another interesting thing is that you find that women are highly recorded for death in the cancer, especially breast and cervical cancer. Is there something that we don't know about the rise, or is it because of cost? Because according to the World Health Organization, cancer was responsible for over 78,000 deaths, with women often bearing the brunt. And you know that it seems like cervical cancer and breast cancer seems to be the highly prevalent. So what are some of the causes of this?
Yeah, the causes of this is that we are having a lifestyle change. You understand? Our lifestyle change is predisposing women to this. However, more importantly, there is a gap in information. There is a gap in awareness, there is a gap in information, there is a gap in facility, there is a gap in mode of payment, because if women, if the populace, not just women, if we are all aware of this malignancy, and that's the breast cancer, cervical cancer, and we are aware that we could screen for them. There is a screening for breast cancer, which is self-breast examination, clinical breast examination, and imaging with mammogram and ultrasound scan. And then we also have pap smear, we have liquid we even have acetic acid, you know, the visual acetic acid mode, that, you know, these are cheap mode of screening. If we're able to raise the awareness, people accept that everybody can have this, and you are able to go for screening, mortality will be very low. Incidence will also reduce, because the pre-malignant lesions will be nipped at the bud. So it will reduce on this incident. However, for those who already have it, if we have good insurance, that, and they know that going to the hospital does not mean you have to start fasting to pay, or you have to go and meet all your family and all your friends, sell your goods, sell your house just to get treatment. If the treatment is through insurance, people will present early and they will have good prognosis. But we have a lot of gap, like I will put it, because we have a gap of information, gap of finance, gap for facility, gap of medical personnel. There's too much gap.
You mentioned earlier, sir, that some things need to be nipped in the bud.
Yes.
And you also talked about gaps that are currently available. Now, I realize that we've heard also that in the developing countries or in the developed nations, that there are vaccines for cancer.
Yes.
So is it possible that if we had a number of these vaccines, there would be less and less as far as mortality rate is concerned?
Yeah, the vaccine, we have some in the country. We have that for cervical cancer in the country. However, it's a bit costly compared to what obtains in other places where insurance comes in and you take it free. And there has to be that knowledge before people would take the vaccine.
Okay.
Because if there's a gap of knowledge, the vaccine is there, but people don't know that the vaccine is there, they don't know what it's for, they won't go for the vaccine. So this is still part of the gap. There are vaccines that we can give young female and young male, and even elderly female that does the test and is fit to have the vaccine. Okay. Vaccine is available, but it's not free, so it's not really readily available, and there's a gap of information. Most people don't even know about it. These are gaps to be bridged.
Okay, and also the World Cancer theme is a 3-year theme, which of course started from 3 years ago. Exactly. What can be done to make sure that, okay, we achieved some things 2 years ago, this year? What are things that we can do to kind of bridge the gap?
More importantly, if you know what to do, that's when you work towards it. Knowledge, raising an awareness, and not only for the populace, but for the authority and key stakeholders. They need to know about what's happening. They need to know about this aim. And if they know about it, that's when they'll start to implement it.
Okay.
All right. So, sir, also, talking about prostate cancer for men, there's the perception that it is always for older people. And also generally, breast cancer in women and cervical cancer as well, there's an assumption that it's always older people, older citizens that are prone to cancer. So is this a myth, or is this something that we should be concerned about?
Well, to start with, we have different cancer for different ages. Even newborn can have congenital cancers. But when it comes to breast cancer, the older a lady is from puberty, the higher the risk of developing breast cancer. However, the risk of breast cancer the peak age of developing breast cancer, that's how early someone can develop it, is lower in our own environment. It's about 10 years lower than in Caucasian, in the whites. So we are beginning to see increasingly younger people developing cancers. You understand? Both the prostate and the breast. And for those who have family history, they are even likely to develop it at a younger age. And those who have genetic mutation, that's is their gene that has issues that is predisposing them, they develop it usually earlier than the general people. And their own case is usually also more aggressive than the general population.
Okay, just to wrap up the conversation, the theme, like we said, is close the care gap. And what treatments are available for cancer in Nigeria, and how can we kind of reduce the cost of this treatment and make it affordable?
Even though, like I said earlier, we don't have much oncology centers in Nigeria, we have a few. But in NSIA, we have all the parameters, the necessary parameters for cancer. So NSIA-LUTH Cancer Centre. In LUTH, there is surgery. There are different, surgical units that can tackle the surgical aspect of cancer. But in the NSIA-LUTH Cancer Centre, which we have specialized equipment like linear accelerators. We have 3 linear accelerators in one center, in NSIA-LUTH Cancer Centre. That's the only center in West Africa that has 3 linear accelerators in one center. We also have a high dose rate brachytherapy facility. Brachytherapy is an internal radiation. It's used to deliver very high dose radiation to a tumor, at the same time sparing the normal tissue. So the side effect is very low when you use such a device.
So it means that the government needs to sort of come in and help to subsidize this cost, and people need to also get tested, more information for testing.
We can look at it that way. That would be okay. However, the more practical way, the more sustainable way, is for there to be an insurance rather than subsidized. We should have an insurance that
national insurance
that can take care of this. In that way, it will be sustainable because you will be getting the money from somewhere and using it for it. As opposed to government subsidizing. So insurance will be better. Like I said, I didn't finish that. NSIS, we also have standard modern chemotherapy suite, and we also give targeted therapy. Targeted therapy are agents that are newer than chemotherapy. They are very more effective and they have less side effects. We also do hormonal therapy. Apart from surgery, all the components of and modalities of cancer treatment is available in NSIA-LUTH Cancer Centre.
All right. Just before we let you leave, sir, let's just ask you a word for Nigerians, just a word to give Nigerians as far as this conversation is concerned.
Yeah, the word is that in Nigeria, we need to close the gap, for cancer treatment and for cancer prognosis. What do I mean by that? We need to close the gap of cancer outcome. And to do this, awareness must be raised. Facilities, we must push in more cancer facilities, and that is not only by government. It's a social responsibility for corporate organizations. They should fund it because this is one way you can, let people know you are working for the population. Then you fund it, give it your name. Then and then we should have insurance.
Thank you so much, sir, because of time.
Insurance to this we will close the gap. We can close the we can.
Thank you so much, sir, for a lot of these words. And must to emphasize that, of course, NSIA-LUTH is a government hospital. So if you didn't know that, it is government. And the government has been doing its best to also help people in that situation. Thank you so much, sir. It was nice having you on the show and getting the necessary information that we need regarding this, because this is also a really big situation that a lot of people face and they don't really talk about. It'd be nice to have you again on Silverbird today. All right, so away from that, we still have more for you. We have trending and we have another guest coming through, so don't go anywhere.